Hi, I'm Tommy, nursing student here at Bellarmine. Today I'm going to talk about the use of some collection devices for patient samples and also oral care patients and some devices that we would utilize that would enhance that. So we'll start off just by talking about sample collection. Here we have just a very simple cup that you would put any sort of sample in, stool or urine or sputum. The most important thing you would want to do is make sure that you had a patient label once you had collected the sample, that you had a patient label on here and that you had placed it into a biohazard bag to send it down to the lab for analysis. But you could use, if you're collecting stool, you could use just a plastic spoon or any sort of device that you would use to kind of scoop the sample into the collection device, and then you would want to make sure that it was, of course, closed very, very tightly and securely so that you don't have any accidents in transport. This here is a, let's see, this is a specific tube for urine sample collection, and it has boric acid in it. You can see here that there is some fluid here in the bottom, and that would help to preserve bacteria and microorganisms that are in the urine en route to the lab so that they can be analyzed there. This here is it's called a Hemocult. It's a screening test for blood and feces. So you would simply just take a sample of a patient's stool, and you could swab it onto each of these areas here, marked A and B, and you would want to get a sample from a different part of the stool so that you ensure better accuracy. And then this simply, you just simply close this up, and you can send it down to the lab, and of course make sure there's a patient label on it and that it's in a biohazard bag. This is what's called a culture swab. You can use this to swab a sample from the inside of a patient's mouth, and then this simply screws off here, and you would insert this into this tube, and you can send this down to the lab just in this container right here. And this is a specific sputum collection device. This is bigger than this collection device, obviously, and this allows the patient to take off the top and spit directly into this device, which has a funnel that kind of collects that sputum sample. Once you have the sample, you would take the funnel out, throw the funnel away, and recap it, and you've got your sample here. And you could send that down to the lab also. Moving on to oral care, these are just simple mouth swabs, oral swabs that you would see in a hospital. Sometimes these would have substance on it that would be a toothpaste substitute, like dentifrice, that would help to clean the mouth out. Sometimes it wouldn't have that substance on there, and you could just get some water and you just kind of rinse the mouth out. These would be for maybe a patient, if they have trouble maybe this would be good for patients that have issues with aspiration, and you're not, brushing the teeth and rinsing with water and that sort of thing. And this is really cool. This is a toothbrush that has a little pad on the side of it that may or may not have dentifrice on it, but you could use this to brush the teeth, of course, and it's able to be connected to suction to get rid of the products of the toothbrushing. If the patient can't swallow, this would be used for patients maybe who are on ventilators or who had difficulty swallowing. I believe that's it. So that will conclude our discussion today, and that's it. I might cheat. How long is that?